Hi, my name is Emma Bell, and today I'm going to be discussing my brochure on rotator cuff injuries, specifically what they are, the prevention, treatment, and recovery process. So diving in, I just have what is a rotator cuff injury. The rotator cuff is a group of 4 muscles and tendons that stabilize and move your shoulder. So it's the subscapularis, supraspinatus, infraspinatus, and the teres minor. Some common injuries include inflammation or degeneration, and then partial or full tendon tears. Some causes of that could just be repetitive overhead movements, such as like an incline chest press, shoulder press, aging and wear, or just sudden trauma. How it can affect your life. Some symptoms and limitations include pain with lifting, getting dressed, sleeping, weakness and reduced range of motion, compensating with other muscles, which then can lead to injury in the other arm from depending on the injured arm. Limited exercise, sports, and then even daily tasks, such as getting dressed and showering. A fun fact I just included in the middle is that most rotator cuff tears are degenerative, caused by gradual wear and tear from aging and repetitive motions. Most rotator cuff injuries aren't just full tears from like trauma or something, which I thought was pretty cool. Some healing and treatment options. So most of them are non-surgical, including just rest, ice, anti-inflammatory meds, and just physical therapy. And then if you do need surgery, that is for the full or unresponsive tears. And then in that situation, post-surgery rehab is definitely essential in getting back into the gym or just daily exercise. Some prevention and returning to exercise tips. Prevention, definitely avoid those overhead movements that I discussed earlier. Strengthen the supporting muscles, definitely warming up and cooling down after your workouts. A lot of people just skip right over that, but getting into the gym and going back, you definitely shouldn't miss those. Maintaining mobility, taking the rest when needed. So say you usually did 6 days a week, start at 3, work your way up, and just listen to your body when you need your rest. Returning to exercise, definitely start light and slow. Focus on range of motion and control. Don't go for weight. Just try to move the muscles and see how that feels. Definitely gradual progression, and then just monitoring the pain and fatigue that you might feel from these movements. The exercise recovery plan is in 4 separate phases. So for the first phase, it's right after you either tear your muscle and get surgery or just go to a doctor and find out that you have a rotator cuff injury. So during those first 4 weeks, you want to protect the muscle and just try to minimize the pain. So you would do pendulum exercises, you might wear a sling, and only passive range of motion. In the second phase, that is the 6 to 12 weeks, you can then begin assisted and / active motion. So that would be like if you usually did shoulder press on a machine, if you usually did shoulder press on a bench, then go on a machine and do lightweight, and so then that's assisted, and you're not solely just depending on your arms. Just some light activation of muscles, and then phase 3 is the 3 to 6 months. Then you can move into resistance band work, scapular strength, and definitely just light weights. Phase 4 is then 6 months onward. Then you can focus on the plyometrics, sports drills, full return to activity, and just focus on preventing re-injury. Your recovery reminder. Rotator cuff injuries can disrupt your life and workouts, but with the right treatment and rehab, you can fully recover. You definitely need to be patient and trust the process just so you don't re-injure yourself. Movement is medicine and recovery takes time, but it's worth it. Thank you.